Hey pregnant mums, today I wanted to talk to you about posture. And this is a really important thing for you as you go through your pregnancy because if you want to eliminate things like pregnancy back pain, mechanical hip pain and severe neck and shoulder strain, then you need to make sure that your posture is right as you go through your daily movements. So there's a couple of things that are going to help that, and one of the biggest things is obviously training the muscles in the right way. So you want to be making sure that you are doing resistance training and strengthening the right muscles that are going to pull you into the right posture and keep your frame aligned and tall as you walk around and go through your daily moves. But what I'm going to talk to you about today is simple things that you can start using as soon as you've watched this video, and hopefully that are going to help you just remember some checkpoints throughout the day, and so that you, when you get home at night, you don't feel so cramped up and like you've had a really long, tiring day. Okay, so let's talk about basic alignment and what happens to your body in pregnancy. Now, as you go through pregnancy, obviously a couple of things are going to happen. Surprise, surprise, you get bigger in front, your bump grows. The other thing that's a major deal and extra weight on your body is your boobs. And the weight of the boobs is going to obviously have an effect, is obviously going to be affected by gravity as well. So your boobs are going to want to pull you down. So all of these things are trying to pull your spine and your skeleton out of alignment. And if your skeleton is out of alignment, that's where you're going to get compression in discs, and that's where you're going to start to move in the wrong way. So your movement pattern is going to be affected, and you're going to cause injury, and you're going to experience things like pregnancy back pain, mechanical hip pain, and neck and shoulder pain. So here's how you need to align yourself, and here's how you need to think about when you're walking around outside and go through your daily movements. So as you go through pregnancy, this is what's going to happen. Bum is going to go out, bump is going to stick out, shoulder's going to drop down, head is going to go forward to compensate. So all of that is really exaggerated with my movements, but that is basically what's going to happen. So the weight of your bump is going to cause you to compensate here. So to balance yourself, your center of gravity is going to shift. So you will try to do this, or you will start to do this, I guarantee that. Your hip's going to move backwards, and you're going to create this really big curve in your lower back. Now what that does, it compresses the discs that sit into your lumbar spine, and the pressure on that disc is going to cause pain, and it's going to put pressure on the nerves that are coming out of the spine, and it's going to cause it's going to start to cause injury in your lower back. As it's also going to make your belly stick out more and make you look bigger, so that's not a good idea. So let's move up to here. With the weight of your boobs, they're going to try and drag your shoulders forward, because all this extra weight is going to be hard for you to manage if you don't have a strong back. So what will happen is your shoulders will start to drop forward and round, and the chest muscles will start to shorten. So a lot of mums will then start to do loads of chest exercises, thinking, right, I'm going to support my chest by doing bench presses and flies. I'll do 100 reps of flies. Not a good idea, because all of the chest exercises are only going to shorten and contract the chest muscles more. So what you end up is just aggravating this posture and bringing your shoulders in and forward. So then what happens is these back muscles become very long. They stretch out and they become like rubber bands, very long but very tight. You can ping them, and they're so tight they're going to cause you a lot of pain. So what we need to do is lengthen these chest muscles and strengthen and shorten the back muscles. Okay, so we need to be working mid-back area, not chest area. So that will just pull your shoulders back into this nice alignment. And then we'll come up to head. So to balance all the rest of what's going on in your body and make sure that your eyes are staying level on the horizon, your head is going to have to move forward. So it will start to migrate very slightly forward. You won't notice it, but you'll be walking around like this. Okay, and again, it will increase the curve in your neck. So this is going to compress discs, it's going to press on the nerves that run it out from here. You're going to experience pain and stiffness in your neck and shoulders, and you might even get numbness and tingling in your hands, particularly at night when you sleep. So to release all of that, all you need to do is bring your shoulders back and then bring the head back into alignment, and that head will come back automatically if the shoulders are aligned and the hips are doing what they should be. So we're going to start from the bottom, right? So from the knee joints want to be stood over the ankle joint. So you probably want to take your weight back into your heels a little bit. Most people stand with their weight too far forward in their toes, and then they tend to compensate into their knees. And from there, the rest of the body just follows suit. So first of all, just take your weight back into your heels. Okay, so you should have an even distribution of weight now going through your feet. It might feel to you it's a bit strange and that you're totally burying yourself on the balls of on the heels of your feet, but I can assure you that's probably just because you haven't been walking properly or standing properly before. Okay, so knees go aligned over the ankle bone. Then you want to squeeze down the bottom. So squeezing down this bottom is going to bring your hips into neutral. This is going to reduce the curve in your lumbar back and take all the pressure off the disc. So we're going to open up the spine here and allow it to do its job and allow the disc room to move and do whatever they need to do. Okay? Tummy button comes in because that is your transverse abdominis, and that's going to support your baby and your spine and your internal structures. So breathe in, fill your belly with air. Breathe out. Bring the belly button back to spine. Now, as much as you can when you're walking around, you want to be aware of your transverse abdominis. You don't want to keep it locked on all the time, but you want to be aware that it's working. So if you incorporating transverse exercises into your training program, it will strengthen up anyway. Moving on to the shoulders. So imagine you have $100 bill between those shoulder blades. That will pull your shoulder blades back into the right position and align them with the rest of your body. Not only that, but you want to pull your shoulder blades down away from your ears, because most people will walk around hunched up like this, which again is going to crush a lot of the structures up here. So shoulder blades down, shoulder blades back, and you'll notice that your palms have to turn face forward. So when you're standing naturally, you should be standing with your palms face forward for a fully aligned position. Most people stand like that so you can see all the knuckles on the hands. You want to see the palms. Okay, head, chin joint. The chin wants to come back in. So just make a double chin. Put your finger on your chin and push it back. That will feel really strange, but you can, if you run your hand down the back of your neck, you can feel that it's nice and aligned. All the vertebrae are stacked, they're sitting nicely on top of each other. So that is your fully aligned posture. Okay, let's talk about sitting down in your office or in your car. Okay, most people will sit like this. So, typing at the desk, shoulders will automatically drop forward. You can't help that because with your hands in this position, you are internally rotating the shoulders. So they will automatically drop into that position. And if you've got to hold that position for 8 hours a day, your body's going to relax into it. Okay, so you're going to end up sitting like this. Now your head joint will have to come forward because it needs to balance your eyes, because you don't want to be sitting like that and looking down. You want to be sitting and looking straight forward. So your head joint is going to come forward, so your neck is going to migrate. So it's going to give you that forward head position, which is going to put a lot of pressure through your neck and your upper shoulders and your upper back, but also is going to leave you in this position, which is not the most attractive of looks. So to sit properly, you want to scoot your bum back to the back of your chair and make sure that the chair allows you to sit with your feet flat on the floor, but with your thighs at a right angle. So you don't want to be sat in a chair that's too high because your thigh angle would be like this. You don't want to sit on a chair that's too low because you'll be sitting and your thigh angles would be like that. So you want a 90-degree angle here in the knee joint. Sit back into the chair, pull the belly button in and activate that transverse so that it is supporting your back while you're sitting. And then shoulders back, pinch that $100 bill and head comes in. So that should be your fully aligned position. So that could be while you're driving, that could be while you're typing, that could be while you're sitting and watching TV. That is how you should be aligning your posture to prevent injury and to prevent pain throughout your pregnancy. Okay, I hope that helped and I hope that was useful for you. If you've got any comments on that or you want any questions answered, then please just pop them in the comments box below or send me an email, whichever you prefer. Okay, I'll see you soon. Bye.